Welcome to Focus TV for our community today. Hi, everybody. My name is Gwendolyn Bork. I am the president of Focus for our community unity and support. We are the Lancaster Depew Addiction Prevention Coalition, and this is our podcast on a more of an educational front to help our parents and youth and community members ultimately have tools that they need to get through this health crisis. And my guest today is Debbie LaBounty. She is a licensed mental health counselor, and she's also a credentialed alcohol and substance abuse counselor. So Debbie, thank you so much for being with us today. And I really look forward to what you have for us.
Thanks, Gwen. And I'm honored to be given this opportunity to talk a little bit about mental health, specifically as it relates to adolescents. So again, thank you for the opportunity.
All right. So Deb, let's get right into it. Let's start on our presentation and see what you have to offer us. Thank you so much for being with us.
Sure. First I want to just kind of touch a little bit on myself, just so you understand sort of why I decided to, get involved in this. Just trying to move my screen here. My slide is not going forward. So let me just see what I'm doing here. I have it up, but it's not moving.
All right, so Deb.
Go.
Oh,
Okay.
got it. Okay, good.
Yeah, there we go. So yeah, I've been resident of Depew for 30 years, and my husband is a computer technician. He's been working for Computer SOS for 15 years, and so a lot of people in the community know him. My daughter went to Depew High School pretty much all her life. I mean, not high school all her life, but she started in pre-K all the way through to high school and graduated from Depew High School and went on to Fredonia. And now she is a music band teacher for Global Concepts Charter School. And when she went off to college, that was when I decided that I wanted to switch careers, because I was really in banking for the first half of my career life. I actually worked in retail and mortgage banking. So when I decided to get into this career, of course, I had to go back and get my master's, and I got my master's from Canisius College in clinical mental health counseling, and I'm now a licensed mental health counselor, credentialed alcohol and substance abuse counselor, and I'm trained also in cognitive behavioral therapy, dialectical behavioral therapy, which just adds the emotional piece to that, and then EMDR, which stands for eye movement desensitization reprocessing. It's a fancy word for a very heavily researched, there's a lot of science behind it, method for helping people work through trauma. And most people that I've worked with, trauma was really at the heart of a lot of their mental health concerns. I also have an I have trouble saying that sometimes, existential orientation, which is a humanistic approach, which basically tells people, a little bit about themselves, and they become more self-aware, and they learn more through others. So I find that it's been extremely helpful in moving people past their mental health concerns. And I'm currently working as a supervisor for behavioral health for a foster care agency under the Office of Child and Family Services, and we serve 14 to 20-year-olds. We also, I also work as a senior crisis clinician for Spectrum Health and Human Services, and we're under the Office of Mental Health and the Office of Alcohol and Substance Abuse agencies. They're like state regulations to help us make sure that what we do is all evidence-based and in line with what our licensing requires. So that's just a little bit about me, just so you understand my background. So when I decided to work for adolescents, it sort of fell right in line with what we do through the Prevention Coalition, because we're working with high schools and middle and high school youth. And, there's so much going on with somebody at that age. There's so much change going on developmentally. So if for adults that work with youth, need to understand those characteristics. They need to understand the diversity that that is currently part of our multicultural society. And when they do, that helps them do a better job of planning for good treatment for our youth. So Gwen, I just want to share with you some demographics that, that are part of, the understanding of adolescents, where they come from. It's interesting to see that most of the adolescents in the United States come from suburban communities. I think sometimes there's misconceptions about where youth present mental health concerns. So it pretty much covers all demographics. There's no discrimination when somebody has mental health. It doesn't matter if you're, poor or rich or, where you live. Mental health infiltrates all demographics. And this is just a little bit more regarding that. You can see more of a breakdown of the cultural divide. You can see where, where most of the population lies. But all of these populations are experiencing mental health challenges. Also, too, like I mentioned, that it doesn't matter whether you're poor or you're rich, you're still going to, sometimes have problems in life. You're going to have to reach out and ask somebody for help. The only reason this is important, I think, to me, is that if you are living in poverty or below poverty, your access to those services are going to be limited. And that's where the problem comes in. Yes, they have similar issues. Yes, they have similar needs, but they don't have access to those services. So that kind of puts them at a disadvantage. And these youth oftentimes need a little extra outreach from us. And I think that's part of what I like about our group, is that we kind of provide a venue for that. And you can stop me anytime you want to ask questions. If you need any clarity, I'm just going to,
Sure.
there's a lot of information here. I'm just going to,
Yeah, no, keep going, Debbie. Thank you.
Sure. And of course, I do cite some of the sources of this information. So if people want to do research on their own, many of our clients are very well educated and they like to do their own research. So there's plenty of research available for them that they can go and, and get more and more information for their own sense of, for their sense of, what's the word I'm thinking
Well-being,
of?
Yeah.
Yes,
And
peace of mind.
I appreciate that you cite the sources, Deb, and ultimately, you touched on it before, poverty or not, race or not, a lot of things are driven from trauma, as you noticed. And, this is why we're doing this podcast today, is that, this is a traumatic event right now for parents, for businesses and students. So we're trying to provide a service and an education to help us understand our youth and youth to understand themselves. So go ahead, Deb. Thank you so much.
Thank you. And yeah, and I agree. The trauma is such a big part of this, that most approaches now are using the trauma-informed care lens in their approaches so that they can address that. And so we try to, especially with youth, we try to address the trauma right away. When we have a little history on a person's life, we're able to do that. And we won't be able to get into this today, but someday when we do more of this, I can explain that, most adolescents will not open up about their trauma, because they might still be experiencing it. And it might be affecting people that are close to them as well. So it's not an easy thing to get a trauma history from a youth, but it's important to know that it's there. And we find other ways to kind of be able to help them and to try to gather, relevant information. Most adolescents do receive care in these three settings. There are the mental health setting, the educational setting, and then of course the physician setting. So either of these settings can both assess and refer or diagnose or even treat the adolescents. So there's a lot of different ways that they can seek mental health treatment. And there's a continuum of care, right? Everyone knows that life is just a continuum that we toggle, and there's an ebb and flow that we toggle between. And we can, at one point in our life, be in a very low level, mild level of necessary mental health treatment, or we can be going through an incredibly traumatic time, like right now, where that continuum grows to the other side, where it becomes more intense and it really interferes in our daily functioning. So there's many levels of care, and we try to continually assess someone to determine like if they need that higher level of care, and we need to refer them to a more intensive treatment. So as you can see by this list, it's pretty comprehensive. And at some point in the future, we can go into more detail on those kind of things. And I touched on it earlier. For some people, there's a lot of barriers to treatment. This is just some demographics. I won't go through every one of them, but you can see that there's particular problems that will interfere in someone getting treatment. And of course, the biggest one is the cultural norm and the stigma. We're hoping that it will begin to change, but I imagine that's always going to be a bit of a challenge. All of us know, I tease my husband a lot about this because he has to remind me that I'm not a counselor at this moment. I don't have to psychoanalyze what he's doing, right? But there's this sort of sense of, well, if I see a counselor, that must mean something's wrong with me, right? But Oprah Winfrey said it best in one of her famous interviews, is that when she was going through her mental health and she was trying to make it much more normalized, she would say to people that acted really strange to her, like her employee, for instance, was acting out, she wouldn't say, "What's wrong with you?" She'd say, "What happened to you?" It's more of a curiosity, so that it becomes a quest to begin to understand what might have been behind that behavior. And so that kind of breaks down some of that stigma. And of course, we know that there are many youth among us that are sort of considered not normal, even though they are normal. Like I think of the LGBTQ community that really struggles to get services because of just the inability to feel like they can reach out to someone. So we're trying to bridge some of those gaps, and we're trying to remove some of those barriers to those treatment services that are available. And it kind of is important to mention that adolescents are going through a lot of changes. Anybody that has any kind of psychology background, even Psychology 101, they're familiar with Erik Erikson's stages of development, and adolescence falls into stage 5, where it's called identity versus role confusion, right? So the most important thing to a teen is their relationship with others, right? They don't care what mom and dad are thinking right now. They're caring about what's happening in my, peer group, right? So if they don't develop a good sense of their self and their personal identity, they could have what they call role confusion and a weak sense of self. So what they want to do is develop their identity. They want to feel good about their identity, and they want to be able to express that in some kind of way. And that's how you see all the parents kind of freak out when they say, "Oh, my daughter just dyed her hair pink or cut it off or whatever." And she's really just exploring her identity. That may change over time, but it isn't anything to feel threatened about. It's just simply part of their stage of development. So it's important for parents and others to know that this is normal for a teen. But sometimes they can really struggle. We know that teens have a high risk rate of suicide and self-harm. So we do want to pay attention to warning signs. And here's a list of some warning signs. Now, that isn't to say that if they have one of these warning signs, oh my God, I got to send them to, somebody for treatment. It just means that you want to look at the duration, you want to look at the frequency, you want to look at the intensity, right? And if you have a lot of those with a lot of intensity, very frequently happening, then you're probably looking at some mental health issues, right? And you want to at least explore the possibility that they could talk to somebody about what's going on with them. It won't be easy, but it can be done.
Yeah, so just to kind of pause you on that one, Deb.
Sure.
I think that, as parents, some of us right now are also dealing with our own stress and our own anxiety. And, we're looking at the bigger picture of if we're laid off of work, how are we going to, maybe unemployment hasn't come in yet, or we own a business and we're trying to apply for these loans or the money, we're waiting for money to come in. We have employees and their families. So, let us, I think, just remind our parents that, your kids are also dealing with their own stress and anxiety levels of a disrupted structure and normalcy. So if know these signs and talk to your kids and, get in their heads a little bit, because I just saw a video the other day of a father who, his son was perfectly fine before this crisis, and next thing you know, he hung himself up in his room, and his daughter found him. It's like 2 days from his 13th birthday. We don't ever know. We think our kids are just getting through this just fine, but they're really good at hiding their own struggles. So anything we can do to get in, talk to them.
That's a really good point, because, I didn't want to touch too much on suicide because that's a whole new, topic, but it's important to help people to realize that, it's the silence that's the problem sometimes. It's the not telling you the things. If somebody's very open about what they're feeling and stuff, that's a really good sign. Like, even if someone's suicidal, if they're talking to you about it and they're setting up a safety plan with you and they don't have any actual method or intent or, plan, that's a sign that they're dealing with it, and that you can maybe move them past that, and hopefully those thoughts will begin to diminish. That's the idea. It doesn't always just happen just like that. You have to kind of work through it. But when there's silence and no one's telling you, and they're keeping to themselves, that's kind of that's not a good sign. So you want to just and I'm not insinuating that means that they're going to do something, but it does mean that you want to explore that. You want to really pay attention, because silence is never really silent.
Right, exactly.
My professor used to tell me that silence is never really silent.
Yeah,
okay, exactly. It's just another form of communication. But that's a really good point. And as you see on the list, a lot of people resort to drugs and alcohol, parents included. Sometimes teens are struggling because their parents are struggling, and they're coping with alcohol and substance use. Problem with teens and substance use is their brain is still developing, as we talked about prior in some of our prior meetings, that their brain is still developing, and there's a lot of science now that are showing how using substances and alcohol as a teen can really begin to cause problems for that development. And obviously you want your brain to develop as optimally as possible, to get to be the healthiest you can be, and especially getting through school and schoolwork and all of that. We all want our brains to be completely alert. So it's just things to think about when you're experiencing any of these symptoms, and kind of keeping track of the intensity, the duration of them, and how often they're happening. Did I answer that question for you okay? And
No, you did. Yeah, let's
okay,
keep going. I know you got
all right.
a lot of good material here.
Yeah, so I just don't want to cut you off. So I'm just going to touch on this quickly. This is just, these are things that kind of complicate mental health. There are more what we call higher levels of disorders that require more specialized treatment. ADHD, of course, you would need a physician's care because ADHD medicine is usually provided by a physician or a nurse practitioner that has some background in ADHD, which stands for, attention deficit hyperactivity disorder, which we know sometimes is prevalent in small children. And eating disorders are one of those sort of silent things. They don't tell you, but they kind of show it in their eating disorder, right? Substance use. Co-occurring is very complex because you're dealing with people that are using and maybe have an addiction, and also lots of depression, anxiety, ADHD going on, other kinds of things like that, trauma. So most research now is focused on the trauma role of it. Any toxic stress, like COVID-19 is a toxic stress that we're dealing with right now. And just trying to come up with factors that promote resilience in the face of challenges. What I love about TV now is that they're showing a lot of ads for people that show as a society how we can cope with this disease that's infiltrating, the entire world. And that's really helping us because it's showing that it can be done. And it's also showing us how mindfulness and meditations, relaxation really help cope, the coping skill development for reducing anxiety, reducing depression. Depression, one of the best methods that I've learned about that research backs up is to help with depression is walking and just getting out and moving, because you're releasing natural endorphins. You don't need alcohol or anything else for that. Okay. Sorry, my Siri just went off. It's more natural way of dealing with depression. And speaking of research, research is also focused on relationships, childhood activities, and how they interact with biology. So there's a lot of neurological development that goes on in adolescent development, and research on brain development really has a key role in that. I'm not an expert at the brain, but I've had to learn some things about how the brain operates in order to determine, is what's going on with this adolescent emotional, or is it maybe biological? Maybe there's something you've heard of bipolar disorder. There's a chemical imbalance going on in the brain, which can't simply be fixed by just some kind of coping skill, right? It's going to have to require some medication. So, it's important for people to understand that, because they think that, when somebody is struggling with a chemical imbalance and their moods are extremely changing, that has to do with, some way that they're thinking about things. And it's not necessarily so. So it's important for people to understand there's some neurological things going on as well, and biological. The role of the psychiatrist and the physician is important in this, because they can help us with understanding medications, side effects of medications. Most medications go through trials. People will take a medication and say, well, it's not working, and they don't realize that, well, your body hasn't really adjusted to it yet. It might take maybe 3 weeks before you start to see some of the effects. And then you can go back to your doctor and say, okay, I've been monitoring, my response to this medication, and here's what I'm finding out. And then you can work alongside your doctor to adapt to that. They can either change the medication, add to the medication, decrease the medication, whatever it takes to try to find that right formula for you.
So knowing that, you talk about there's a gold standard, Debbie, and we have, we're down to like really the last 5 minutes. So how do we,
Oh, thank you for reminding me.
sure, how do we get, through the gold standards, best practices, telehealth? I mean, what are our resources now let's get into that, please.
Okay, sure. So the gold standard is obviously to touch on every aspect of a child's life, right? There's physical, cognitive, emotional, social, morals and values. That's a big part of it. We never impose our values or morals on our clients because, if I'm of a certain belief system, it may not match theirs, and it wouldn't be fair to expect them to believe the way I do. But we have to touch on those things to see if they are partly at the heart here of what is going on with their emotional well-being. So best practice would be to touch on all of those things and also do things that have some research backing it up. So, they're in an enormous transition, and they're going to go through a lot of changes, and that's okay because it's normal, it's necessary. I always, laugh. I think about them as they're like in this sort of twilight zone between children and adults. They're not quite adults yet, but they're not children anymore. So they're really going through a lot of change, and they can use a lot of help and guidance at times, but it has to be done in a way that fosters, empowerment, self-efficacy, and confidence, so that it doesn't make them feel like they're, still a child. And telehealth is what we're doing right now because we can't be physically together, but there's a lot of things that are a lot of good things to telehealth. And it's important to understand that, some of the challenges with it as well. One of the things that we ran across recently was a client who was talking about some abuse she was receiving, and her abuser was in the room, and we could see them kind of walking by. So it was like, okay, so we need to be careful about, providing that safe place for them when they're going through this.
Yeah, like setting the stage, to be able to have an open space.
Absolutely. And so, we do that, and hopefully then they find that it's a very therapeutic experience. Sometimes there's technology problems, like we have, sometimes Siri goes off when you're talking, or somebody's dog is barking in the background, or there's children underfoot, and we have to kind of be cognizant of, well, let's just wait until things settle down and then we'll get back on track again.
Sure.
And sometimes we can't see them. We can't see their body language, which is such a big piece of therapeutic relationships, understanding people's body language and knowing what's really going on with them. We have to develop such a rapport with them because 70% of the outcomes, the successful outcomes, are due to a good therapeutic relationship.
Sure.
And that's scientifically based. So without that, it's pretty much a moot point trying to do an intervention with them. We got to remain flexible, and for some people it kind of works out nice because they don't have to get in the car and travel. They don't have to worry about setting aside a special time. They can just do it right at home. So there's some advantages to doing the telehealth. So there are parts of it that probably will stay around, will not go away once this virus has been managed.
And I'd like to interject too in a way that just having the ability to see somebody's face, to have, that interaction. A lot of our kids, they text, they snap, they TikTok, but they don't see each other face to face. And, I think that is impounding their isolation. So even to be able to talk to another person on a screen, it kind of stretches their boundaries and what they feel they're capable of doing. So, and it helps. We know on a personal level for adults, it helps. So it's got its benefits for sure. So how do we meet those challenges, Deb?
Yeah, I work on a program that all I have to do is send a teen a link on email, and they click on that link and they're in my living room, or I'm in their living room. So it's nice to be able to do that. And it's very quick, So that comes with, just like you said earlier, the preparation to make sure that living room is safe, right? I don't know how much time we have.
Oh yeah, we got, we definitely, we're on the home stretch here a little while
Okay.
ago, Deb. So we got to wrap it up, but if
Okay.
we could just go over meeting the challenges for
Yep.
like 1 minute
Okay.
and our resources,
Mhm.
that there'll be time's up. Thank you.
Sure. As I mentioned earlier, the therapeutic alliance is the most important part of the relationship. We do spend some time on evidence-based interventions, and that would be like your coping skills, the therapy, for some people, it might be practicing. I do a lot of practice with people because, it might work in therapy, but when you go home, are you doing it at home and are you doing it every day, right? So it's important that people kind of learn how to practice and do homework and kind of really make that effort. And, obviously it requires a lot of mutual trust. Empathy is an interesting thing. People kind of use that term loosely, but they have found that most people on a level of 1 to 5 have an empathetic style of probably 3 or less. So that's not a good, empathetic approach. To really understand a person and put yourself in their shoes, you want to get to a 4 or a 5 on the empathy level. And that takes a lot of active listening, a lot of, reflective listening, kind of saying back to the person with meaning what you think you heard them say, so they know you're really listening to them. And we are leaning more towards solution focused because insurance companies want fast, efficient treatment. They don't want, it to drag on for years and years for the client. It's not in the client's best interest nor feasible. So we try to get right to the heart of the matter, try to deal with exactly what we need to deal with, and have a solution that actually, decreases their symptoms.
Right. Yeah, because right now we don't really have time to
Right.
spend months and months. These
No.
kids have already been isolated for, almost 2 months now, right? And potentially another month, and potentially the full half of a year, really, from their friends. So solution focused is important. It could mean, life or death, I would assume, to some of these kids. And where can we get some of these resources, Deb?
Yeah, and there's lots of places available. You've been seeing a lot more commercials on TV lately. I'm just putting a few places down that I'm very familiar with in my work. The 3 on the top are through a particular agency, but there's several agencies out there that offer the same types of services. But there's emergency lines, there's crisis counselor lines where where you can just talk something through with someone. There's the cares for the children and the teens. Erie County has their own crisis service lines. Other counties have their own crisis service lines. So, you can easily Google those phone numbers. But obviously, in an emergency, you don't want to have to Google. You want to have this like at your fingertips. So I always tell people, have it in your phone. So all you have to do is press one thing, and there you are. You're connected to the person you need to be connected to. There's addiction hotlines. There's kids helplines. What I like about the kid helplines is the kids can call, and they don't have to worry about mom or dad knowing about it. They can call and get some help, especially if some of the issues are occurring at home. And then of course you have specialized lines for domestic violence, and obviously, if you feel imminent danger or if your life is threatened, you're going to want to call 911. That is always your first line of defense in any kind of a life or death threatening situation.
Thanks a lot, Deb. I appreciate, putting this presentation together. If you stop sharing your screen, I'll share my screen with the resource that you put together for us. And it is right here. So, how to prepare for a video appointment with your mental health clinician, what you should do before the day of the appointment, on the day of the appointment, how to start your appointment, and if you have any other questions, to go to this particular website. So, we're going to make sure that we have this this particular flyer available to, you know, our people that are watching this. We're going to also make sure that we have your presentation available if that's allowable.
Sure.
And, you know, that way, at least our people right here in Lancaster, Depew, I mean, we're focused on our community and providing resources. So Deb, thank you so much for your time. Appreciate
You're very welcome. My
all
pleasure.
the awesome insight that, you know, you provided us, because, hey, if we take 1 second out of our busy day, you know, just to address maybe what our kids are going through, I think that, you know, even as teenagers and they're not really, you know, they're focused on their peers and that peer support, you know, we still can be in the loop as parents and know what to look for, know how to help them, and have those resources available at our fingertips when we really need them, because I think you can agree, when they need them now.
Mhm.
So thank you for your time, and
You're welcome.
I look forward to maybe seeing you on a future episode.
Thanks for giving me this opportunity.
All
Have a
right.
great day.
Thanks, Deb.
Bye.